was trying to think of a topic that I sort of wanted everybody to sort of do more often, and the idea sort of came to me in a public bathroom. I was just, I was sitting in front of the sinks, or standing in front of the sinks, and I see these people going in the sinks, just dipping their hands in the water. Some people just walking out. I'm just like, what are these people doing? And so, the topic I wanted to talk to you about today is hand washing. And since, we're all practically going to go to the healthcare field, I felt like it was relevant as well. Now, just a question. How many of you all got up today and washed your hands? It's okay. It's okay if you did it. I mean,
Oh, you did not just.
Yeah. Okay. I expected at least like all of you to wash your hands, but that's not the main issue. I think the problem is that most people don't wash their hands properly or don't do it as often as they should. Now, just to give a brief history of the effects of hand washing, Ignaz Semmelweis was an Austrian-Hungarian physician, and he discovered that hand washing decreased the spread of germs and infection. And this was demonstrated over 150 years ago. And he was working in a hospital, and for some reason, a lot of his maternity patients were dying to the point where they just wanted to go home. And what they related it to was because student physicians who had initially worked previously with corpses in anatomy class were the ones taking care of these maternity patients. And so they ended up contracting the germs and eventually dying. And the result was a death that was 5 times higher than the average hospital, and which was pretty crazy. And so what he did was he decided to let these student physicians wash their hands. And when that happened, the death rates went down fivefold. Your hands, basically, you do everything with your hands. Like, you touch people, you hug people, you write with your pen, you do your business, whatever. But it's basically your main tool to use throughout life. And it comes in contact with everything, such as germs and bacteria. It's your first line of defense against the germs. And our hands can contain about 1 million to 1 billion invisible bacteria. The dangers of not washing your hands. The most obvious reason is infection. You could contract it, you could spread it, but also, like, in worst case scenario, you could eventually die from it because one illness leads to another, and things just get worse. And according to the Center for Disease Control and Prevention, half of all food-related illnesses are caused by unwashed or poorly washed hands. And some examples are flu, diarrhea, meningitis, hepatitis A, and a whole lot more. And effects of not washing. Again, if proper hand washing is not implemented, especially within the hospital, hospitalizations would nearly increase fivefold, and sickness would be rampant everywhere, and most likely, would be missing school, which some of us might like. Yeah. Now, how to properly wash your hands? First of all, you want to wet your hands with warm water. Warm water is preferred over cold water. And apply liquid soap or use clean bar soap, and make sure you lather well. You want to rub your hands vigorously, and I repeat, vigorously together for at least 15 to 20 seconds, and that's about, saying the ABCs once or singing happy birthday twice. And you want to make sure you scrub all the surface. Now, most people wash their hands without really going in between the fingers or in between their fingernails, and that's really mostly where most of the germs are located at. And you want to rinse well, and make sure that you dry your hands with a clean or disposable towel. And if you can, make sure when you do turn off the faucet, use a towel that you just washed, just out of convenience, because that faucet that you turn on has germs on it as well. Here's a picture of the basic steps. Basically, wash hands, soap, lather, scrub, rinse, and dry. And a list of when should you wash your hands. Of course, after using the toilet. That one really bugged me. I had a weird story about that. And Even after changing a diaper, after touching animals or animal waste for those who have animals, and especially before and after preparing food, before eating, after blowing your nose. And funny thing is, like, the number one reason we get colds is because we touch our nose with our hands, and that's basically where all the germs come from. And after coughing or sneezing, before and after treating wounds or cuts, before and after touching a sick or injured person, after handling garbage. I'm guilty of that. Sometimes I don't wash after handling garbage. Before inserting or removing contact lenses, and when using public bathrooms. In conclusion, despite the proven health benefits of hand washing, many people don't practice this habit as often as they should, even after using the toilet. Hand washing doesn't take much time or effort, but it does offer great rewards in terms of preventing illnesses. Adopting this simple habit can play a major role in protecting your health. Clean hands, safe.